Tiki Barber here with John Gallucci Jr., President, CEO of JAG PT, that's physical therapy. You are a licensed physical therapist and a certified athletic trainer. So you're the perfect person to ask about all of these injuries that have taken place in the NFL in the first couple of weeks. I want to start with a really important player because he plays running back, and that's Christian McCaffrey. Christian McCaffrey missed the first week and the first 2 weeks because of a calf injury that became an Achilles issue. And we know that with the Jets, Jermaine Johnson tore his Achilles. How do you manage that lower calf strain and get yourself back on the field?
Well, that's a great question, and there's a big difference between a strain and a tear. So we have to understand that if you tear it, most likely you're having some sort of surgical procedure. If you strain it, you're going to get some treatment by the training staff, and based on how much swelling and bleeding and stiffness, how much weakness occurs is how long the timeline is going to be. As we could see with McCaffrey, it's evident that they were trying to manage it, and then it just became a component that, as you know, the season's short, so it became a component that they had to put him out and do it the right way and bring him back slowly.
Those calf injuries / Achilles injuries scare me. Because if I was an athlete and I had a calf Achilles injury, I would always be in my head thinking, I'm going to tear this. I'm going to tear this. How do you rebuild someone's confidence when they have that type of injury?
And realize you're using your calf every day for walking up and down stairs, getting in and out of bed, getting off of a chair. So everyday movement, you feel it when you hurt it. So you have to understand, just like anybody in sports, you want to be 110% before you're back in the game. So what happens, it becomes a component of motivating them, showing them what they could do, showing them their full flexibility is back, showing them that they have strength equal to the other side. And then, as you can imagine, it's all about functionality and putting them through simple speed drills, simple strength and conditioning drills, and showing them that they can handle the rigors of their position. As you know, as a running back, if you can't get that quick burst out, you're dead man standing, technically.
Right.
So ultimately, you've got to be stronger. And listen, the athletic trainers and physical therapists in the NFL are at the top of their game. Research is coming out of the NFL every single day. So the players have some of the best in the world working with them. And ultimately, we need to make sure the player's ready before he returns.
Let me get to a major issue that I used to deal with all the time. I was a sprinter growing up. I was a sprinter in college, and I always had hamstring issues. It was something that it felt like I couldn't ever manage. Maybe it was an imbalance. Maybe it was lack of strength or whatnot. But T. Higgins, who was a wide receiver for the Cincinnati Bengals, has been dealing with a hamstring injury for a lot of his career, but particularly this season. How do you manage the hamstring and get a guy feeling comfortable and fast again?
So it's a great question. So the hamstring is a very long muscle. It's a muscle that we have to understand does not get a lot of attention strengthening. Over the last 10 years, we've seen all these hamstring programs and research coming out that's really developing. It's actually developing more and more out of the soccer world. You're seeing it tremendously because in soccer, we have a tremendous amount of hamstring injuries. And as you know, I do some work with soccer players as well. So, but the research coming out is the eccentric loading or the lengthening of the muscle is the most important thing during the rehabilitative process. And ultimately, once you get the strength and flexibility, it's can't push them too quick for sprints. We got to make them jog first, kind of building up. Sometimes the athlete wants to just go. And that's actually when the training staff and the physical therapists have to pull them back a little bit and say, wait a second, this is a slow progression. Otherwise, this is going to plague you all season. And we've seen that. We've seen athletes plagued all season in all different running sports.
Yeah, you're right. And we see this locally with our team, our New York Giants. Graham Gano had a groin injury. He ultimately got a hamstring injury, and I don't want to say it cost the game, but it made it very difficult to manage that game. How do you deal with these injuries that become something else?
Well, as you can imagine, when one muscle's not working, other muscles have to compensate. And ultimately you're putting a strain on those muscles, and sometimes you can tear on the same side or strain on the same side a muscle. As you know, the New York Giants has the top medical staff in the NFL in my eyes.
Yeah.
They're colleagues and friends for years. They're good people. They're unbelievable research. But people are people. At the end of the day, there's many factors of groin strains, hamstring strains. It could be simple things as rest and sleep. It could be hydration. It could be nutrition. It could be fatigue. So there's so many components that come into a strained muscle that people think it's, oh, how can he be an elite athlete and just strain a muscle? I'm a 57-year-old man and try to run a 5K and you strain a muscle. Well, anybody can strain a muscle because there's so many factors that go into the musculoskeletal component of the human body that people have to realize. Yes, they're high-level trained athletes, but they are people, and it's going to happen. And just remember, if they didn't get hurt, they wouldn't need me.
No, you're right. It's good for your business. Unfortunately, the position I played gets a lot of pounding. Running backs get hit a lot. And we just saw Isaiah Pacheco, one of Rutgers' finest, got hurt this past weekend with a broken fibula. Now, that's the small bone on the outside of your lower leg. And
of your shin, correct.
Yep, and it should be okay. But those type of injuries are so frustrating, and recovering from them it's odd because some people recover quickly. Some it could take up to 6 to 8 weeks. So recovering from a broken fibula issue, what's the best course of action?
It's a great question. Listen, the days of Willis Reed walking out onto the MSG and playing basketball with a fibula fracture are gone based on the safety of the athletes. But ultimately, the really good thing is it's not a very painful break, and it's not a weight. It's a weight-bearing bone, but only 10% of the weight. So your recovery because of pain is going to be quicker, but it's still a broken bone, and it takes 6 to 8 weeks to heal. And you can't put an athlete back on the field with a broken lower extremity bone unless it's truly healed and has good calcification. But what they're going to do during his time off, they're going to try to keep his aerobic capacity up, most likely do some pool workouts. It's very, very big with lower extremity injuries to have people do pool workouts for the aerobic capacity. So this way, they're going to keep his entire core strong, his upper body strong. They're going to keep his entire musculoskeletal system strong. So when that bone does heal, it's basically bring him back slowly on the field and get him going. So here we are early in the season, there's a good chance we're going to see him by the end of the season playing at full go, and everybody's going to say, how did he recover from a broken bone when I sprain an ankle and it takes me 16 weeks? We're going to see him back on the field as long as they do a nice general progression of recovery and as long as they keep his aerobic capacity and strength up.
Yeah. So let's talk about a different type of bone injury. I'm talking about a bone bruise. Tight end Jake Ferguson has a strained MCL and a bone bruise. I feel like I had one of these when I was playing, and I don't remember the mechanism on how long it takes to heal, but also the process. And if there's an additional vulnerability because your bone is quote unquote bruised.
It's a great question. So first of all, bone bruise is exactly what it is. There's a little bit of bruising on the bone. That could take 2 weeks, 3 weeks to feel normal. It's usually from the pulling of the MCL, from when it opens up the joint, and you get that pulling where the bone attachment is. Now, when you look at the MCL, depending upon the grade, you could be back in 20 to 21 days, and especially depending upon the position you're playing,
Right.
You know, there's certain braces that we can put on the athletes to get them back in the game. But an MCL sprain that's a first degree, you should be able to see an athlete back as quick as possible. Realize I'm not treating this athlete. I don't have the MRIs. I don't know what degree. But a simple MCL sprain with a bone bruise, we're hoping we could see an athlete back on the field within 3 to 4 weeks, rocking and rolling. But if it's more than that, then it's going to take more time.
Yeah. John, you've been around football for a long time, so you remember those moments when the NFL started to really worry about repeated head trauma. And it's a sensitive topic because Tua Tagovailoa, the quarterback for the Miami Dolphins, has had 3 diagnosed concussions in the NFL. He had 1 in college as well, so 4 in 5 years. And it's hard to speak specifically about his case. Obviously, it's a decision that the Dolphins and Tua and his family are going to ultimately have to make. But the thought process as a licensed athletic trainer, as a physical therapist, how would you advise an athlete who would come to you and talking about that particular issue with concussions?
It's a great question. You know, the biggest thing is there's life after sport. You have children, you have family, you have so many different things you can do. And I definitely don't want to guide Tua in any way, shape, or form. But when you have 2 concussions the way we saw on video in the games, it's really time to think. And hopefully the medical team down there is really working with him and explaining to him the possibilities of what can happen in the future. Ultimately, as you know, the NFL and all the pro sports in the United States, the collegiate sports in the United States, and even the high school sports and club sports have invested billions of dollars in research on true protocols. But at the end of the day, as we discussed with the other injury, we are human beings, and everybody who's afflicted by an injury recovers differently. And when you get an injury, it affects you differently.
Right.
You know, Tua with these last 2 concussions, again, if I was his certified athletic trainer, I would be working with the neurologist, the neuropsych, and really sitting down with him and explaining to him what the possibilities of long-term possibilities of effects are going to be.
Right.
Listen, football is an awesome sport. They've done great jobs. They've led the way in research on concussion treatment, concussion identification, concussion management. Dr. Alan Sills has done an awesome job in building the protocol. The athletic trainers and physical therapists and physicians through the league and all our leagues. You see it in Major League Soccer, the NBA, the NHL. You see it. Everybody is on the collegiate league, NCAA. You're seeing it all over. I helped build the program for the New Jersey sports with down in Trenton with the governor at the time. It was Governor Cody. We are doing so much to prevent concussion, but at the end of the day, realize you can slip and fall down your stairs. You can slip on ice and get concussed.
Right.
So you're in a car accident. It could be a simple 10-mile-an-hour bumper to bumper, but because your brain sits in fluid, if it reflects off the skull, you can be concussed. So people want to label sports as to where you're getting concussed. You can get concussed. Your daughter ice skating can get concussed. So there's so many ways. So I think our research has evolved tremendously on identification, treatment, and return to play protocols. Now we also, in the school level, have return to school protocols. I think we're going in the right way. But when we come to Tua, the Miami Dolphins, they have a big decision to make over the next few weeks.
I got one more for you because there are a lot of weekend warriors out there, including me. I've run 15 marathons in my post-NFL career. I train. I like to stay fit.
You love to keep us busy at JAG Physical Therapy.
I do. I sent my son over there.
Right.
But I think you might have to go over there. You ran a 5K and you jacked yourself up, man. How would you treat yourself for your injury?
So that's a great, forget about it. So I trained for 6 weeks for a 5K that we did for the Valerie Fund to raise awareness for children with cancer and blood disorders. And ultimately, I train all year. Every day, 7 days a week, I'm doing something aerobic. I felt great the week before. Here I am. I'm in the middle of the 5K. Our chief marketing officer has video of me, people watching me run the 5K. And there's this little girl at the turn saying, "Turn here." And I'm like, "Oh, this is so cute." I say hello to her. I make the turn and pop, my plantaris, which is a muscle in my calf, pops, and I'm like, "Oh my God, I'm going to embarrass JAG Physical Therapy, the Valerie Fund, and Kayla George, our chief marketing officer, because I tore a tendon in my calf." You treat it like a strained calf. Basically, you got to decrease the inflammation. One of the biggest things that we don't teach the general population enough is the RICE method, which is rest, ice, compression, and elevation, keeping the inflammation out, getting motion back as quick as possible. But it was funny because picture, I had 55 physical therapists running with me, all making fun of me for an entire week.
Right.
At a simple 5K. But again, like I said, we're human.
But you finished.
I finished.
That's all that matters.
Because I was not going to let anybody say I didn't finish it. Finished it in 32 minutes, and I was proud for a 57-year-old non-runner. I was a wrestler. We had a little circle. You didn't have to go far in the circle. But ultimately, we were very lucky, and I'm blessed that the team at JAG Physical Therapy got me rehab back, and we have another 5K coming up with the New Jersey Devils run. It's called Running with the Devils, and we're pretty excited, and I'm going to be running that one as well.
That's awesome. John Gallucci, President, CEO, JAG Physical Therapy. Thank you, my friend.
Thank you. Appreciate you.